Hi, I'm Jim Edge, and this is Veterans Affairs. Today we've got an old friend back. In fact, I think today, Bernie, you surpassed the governor as our most frequent guest with this show today. I haven't been keeping an official count, but as everybody can recognize, our guest today is Congressman Bernie Sanders. And he said he was going to be in Rutland today, so we nailed him. My first question, I know this is on your mind too, is last time you were here, about a year ago, one of the things you mentioned at that time was you had some sort of an initiative going to take the Desert Storm syndrome testing away from the Pentagon and the VA and put it out to some independent colleges or something, I think it was at the time.
Let me back up if I could, Jim. The bottom line is that Gulf War illness, the Gulf War syndrome, is a very, very serious problem. It is affecting, we had about 700,000 people over there. The estimate is that close to 100,000 people are suffering from one or another ailments. And these ailments are headaches, they're rashes, they're short-term memory loss, they're gastrointestinal problems, sexual problems, depression, whole bunch of syndromes that people are developing. And what people were not aware of is that people thought, well, yeah, maybe it's a lot of other folks, not people in the state of Vermont. The fact is there are hundreds of Vermonters who are also hurting. And just a week and a half ago, we held a meeting in the hospital in White River for folks in the southern part, central part of the state. We had 45 folks coming out who are hurting. And then we had a meeting in Burlington on Monday night. Over 90 vets came out who are hurting with many of these symptoms. It has been my feeling from the very beginning, to be very honest with you, that the VA and the DOD have done a horrendous job on this issue. When the men and women came back and they complained of these problems, what the government was saying is, well, there really is no problem. We're sorry, maybe after every war there's a problem. Then
you know how that strikes us Vietnam vets, right? With Agent Orange, here we go, deja vu all over again.
Well, we're going to talk about that too, okay? We're going to put that on your agenda there, all right? Because we're going to talk about that. So there really is no problem, and stop your complaining. And then after tens of thousands of more people coming in, what the VA and the DOD say, well, actually there is a problem. We recognize there's a problem, but it's a stress-related problem. War is very stressful and so forth, and we think all of these symptoms are related to stress. And then when it turns out that I am on a committee which looks at these things, and very fortunately, the chairman of the committee is a good Republican. I'm going to give credit where it's due. His name is Chris Shays from Connecticut, who has done an outstanding job on this issue. And Chris and I have worked well together. And we held hearing after hearing after hearing, and we brought up veterans who were really sick, and then we had the VA and we're saying, tell me why there's no problem. Tell me how this is not a problem. Tell me what you're doing to understand the cause of the problem. Tell me what you're doing to try to treat the veterans. Now, meanwhile, what was going on is all over the country, veterans were flocking into VA and DOD hospitals. They were getting a terrible treatment. They really were. If they weren't being dismissed and given a Prozac or an aspirin, they were getting even worse. So we worked very, very hard on this issue. The end result, not the end result, but where I think a breakthrough is coming is the following. My position has been all along is that even if you don't know what the cause of the illness is, what we do know is that the theater there, the military theater, was a toxic disaster. Just terrible. We know that our soldiers were exposed to chemical warfare agents as a result, at the very least, of blowing up an arms depot in Camisea. We know that there had heavy uses of pesticides. We know that there were oil wells, of course, that were blown up that were polluting the area. We know that the soldiers were given pyridostigmine bromide, which is an anti-nerve gas agent. We know that they were given various other vaccines. Nobody in the world knows what the combination of all of these things may mean to a particular person, particular man or woman. My view was that even while we are continuing to do research as to understand the cause of the problem, we have got to do our best to try to develop treatments to do the best that we can. There have been people primarily outside of the government who have done some good research. There was a guy in California named Garth Nicholson, who is a researcher, who is not a physician but worked with physicians. He is a PhD, and he discovered, working with physicians, that heavy doses for a long period of time of an antibiotic called doxycycline could have a positive effect on those soldiers who were mycoplasmic infected. Okay? So to make a long story short, the good news is that finally, at the insistence of some of us, there will be 2 test trials that will be done in approximately 30 hospitals. Will be doing one or the other, and I'm happy to say that White River will be doing both. So if any veteran out there was over in the Gulf, knows anybody who was over the Gulf who was not feeling well, they can give my office a ring in Burlington, they can give the VA hospital a ring in White River. There will be 2 trials, and in the very near future, people are going to be signed up. One trial is if you test, they're going to do a blood test. If you test positive for what is called a mycoplasmic infection, and the estimate is that somewhere between 25 and 50% of the veterans will test positive for that. If you test positive for that, a trial that you might get involved in will require you to take doxycycline, which is an antibiotic, for an entire year. At the end of the year, the VA will make an analysis to see how well people are doing or not doing. Half the people in the test will be given a placebo, so we'll be comparing the two. Then there will be another trial which will involve more folks. What that trial is about is not really getting to the cause of the problem, but it is more related to disease management. There are a lot of people who are ill, who are suffering a bunch of symptoms, are having marital problems, and this will combine aerobics and exercise along with cognitive therapy. There'll be a psychologist involved, helping people better to cope with the problems that they're having right now. Those are the 2 trials. The second trial that I meant has already been going on for a while in Walter Reed with some success. It's making people feel a little bit better, a little bit more comfortable, a little bit better able to function. The first test using doxycycline has been done anecdotally. It's been done here, it's been done there. People report success, but the purpose of this trial will be, at the end of it, we will know whether it works or not. If it does work, that will become a treatment of record. Furthermore, we have gotten some money together so that there will be a major conference at the end of February, sponsored by the Center for Disease Control in Atlanta, Georgia. I'll be the keynote speaker there, and we're going to continue the progress. This is the beginning, not the end. But the bottom line of this is I think we have turned the tide a little bit. There are some real serious treatments out there. We've got a long way to go. And if anybody needs more information about that, please do not hesitate to call my office. As you know, Jim, Don Edwards, who used to be Adjutant General for, I think, 13 years, is now working in my office, works with us on Veterans Affairs.
I see Don regularly.
Good. And if people have any problems, please give Don a ring.
I have a question just for my own edification. What is their reasoning with playing games like with Agent Orange and with this? I mean, so if you lined up all the vets that were there and they're sick end to end, it couldn't cost as much as 2 or 3 B-1 bombers, you know?
Gee, you're giving
Is it money?
You're giving my speech for me, Jim. They asked a good question, and to be dead honest with you, I don't know the answer. And I don't want people, you know, what sometimes bothers me is people get paranoid, you know, and they get into conspiracy theories. I'll tell you the best that I think, and I don't have a definitive answer. On one hand, my experience, at least with Gulf War illness, is this is a new type of illness. If you come back from a war, shot up, you know, you got shrapnel wounds, you lost your arm, they have pretty good treatments. They know how to treat you as well as anybody in the world knows how to treat people in those conditions. It seems to me, and to some people, that Gulf War illness is a different type of illness relating more maybe to chemical injury or mycoplasmic infection, which is a new type of thing. And I think these guys are just not as sophisticated. This is pretty new stuff. We know that there are some what we call people in what we call environmental medicine. You could be working in a plant. You could be exposed to chemicals and you're getting sick. You walk into your average doctor, there's a whole process called multiple chemical sensitivity. I don't know if you're familiar with that. Mm-hmm. And a lot of doctors are just not familiar with this. And I'm sorry to say that I think that's true in the VA as well. So I think that they said, well, we don't know what's making you sick. We're giving you a test here. Yeah, I see that you're sick. I see that you're getting rashes. Yeah, I see you have short-term memory loss. We really don't know what it is. We're not comfortable with this type of illness, and get the hell out of the office because we just don't know what's going on. So I think there's a little bit of that they just don't know. Second of all, there are some who argue that money is a consideration. That if you come back and you really are unable to work effectively at a job, if you're really sick, that you're entitled to disability benefits. And that might be a bit of an expense. And that takes us to the broader area outside of Gulf War illness about how the government has treated veterans in general. And I think it's been a disaster. I think there have been cutbacks all over the place. We're seeing that in White River. We'll discuss that in a moment. But in a whole lot of programs, veterans are not getting their due. And that is, let me tell you a little bit, it's bipartisan. I know some people want to blame Clinton. Some people want to blame the Republicans. I think both deserve their share of blame on that one.
But it's nothing new. I mean, it's been going on for,
It's probably
what,
getting worse.
40, 50, 60, 70 years?
It's getting worse. I mean, the bottom line of this issue, and let me tell you something, I am an anti-war member of Congress. Don't like war, I vote against the wars often. But I think if the government decides to send a young person over there, you have a moral responsibility to say, okay.
Well, that's our feeling, of course.
That's your thing. If you're asking somebody to put their lives on the line and these people do their job, then the government has got to keep its end of the bargain. And it disgusts me when the government reneges on that contract.
I think there's an implicit contract.
There is a very implicit contract. I mean, if the government votes to have you put your life on the line, and you accept that responsibility, and you do that, and you come back wounded or you come back hurt, you have done everything that the people of the United States of America have asked you to do. The people who sent you there have their responsibility too, and they've got to honor their contract. And that is, to break that contract is pretty awful. So that's an issue that we're on. May I touch on Agent Orange for a moment?
Sure.
And I want your help on this, because you may know more about it than I do. There was an article in a paper in San Diego that came out a couple of months ago that caught my attention. And it was a result of, I think, a 6-month investigation by a pretty sharp group of reporters there. And what they were claiming is the Air Force is now involved in a huge study trying to determine about how sick or not sick veterans were who were involved with Agent Orange. And it's called Operation Ranch Hand. Are you familiar with that study at all? Well, what this reporter was saying is that the Air Force was fudging some of the figures, was in fact not being totally honest in reporting the reality. This does not shock you? Maybe I'll give it over to you, Jim. Because number one, obviously this would be an outrage if this were true. And if it is true, those people, and I'm on the committee to deal with this, have got to be dealt with very severely. That's inexcusable. But second of all, what also interested me about the Operation Ranch Hand study, and I didn't realize this, I should have, but I didn't. This is being conducted by the Air Force. It is primarily studying people who were in the Air Force who were spraying the stuff.
Handling the stuff.
Yeah. Handling the stuff. But it is not dealing with what I think would be those people who...
People on the ground who were sprayed.
Yeah. Well, tell me about your perception. Am I missing something here, or is that...
That's why to us the whole thing with Desert Storm seems like deja vu, step by step, the whole thing. I mean, it's almost identical, the whole process.
Right, let me tell you.
No, you're not sick. I don't know how you got this. You got it somewhere else, not in the military. No, that stuff couldn't affect you, la, la, la.
This is what we are doing. And one of the leaders in terms of the Agent Armors is Admiral Emo Zumwalt.
He lost his son.
He lost his son. And here you almost have...
To Agent Orange.
That's right.
And he ordered him to go there.
Do you know more about... I mean, this is almost like a Shakespearean tragedy, where he was the man who was responsible for ordering the use of this, or at least following the Pentagon decision, and his son, in fact, died, and I believe his grandchild has severe learning problems, which he believes is directly attributable to Agent Orange. Now, I have to plead guilty here and tell you that I had been under the assumption that this issue had finally been addressed. I know the veterans had fought very hard for it. I had been under the impression that Congress finally had done the right thing, that people were getting their due compensation, were getting their due health care. And what I have learned recently, of course, is that is not the case. Some people are.
Narrow, a very, very narrow, if you have this cancer,
That's
maybe
right.
It was Desert Orange. We had a kid in the office last summer with spinal bifida, where his dad, from Vietnam, they laid it all back there, and there's a shame. There's a young man, born 30 years after the damn war who had nothing to do with it, and for the rest of his life he's in a wheelchair.
Yes. And I think that is one of the areas that is, in fact, covered. Is that
But
right?
at least, whatever his dad had, whatever cancer he had, they followed it through. The
Yes.
spinal bifida is a common
Yes.
occurrence thereafter. And
Now, I want to say two things. First of all, the debate obviously is what other illnesses did those vets themselves suffer and might pass on to their kids. And I think that issue is far from resolved. And I'm happy to tell you again, we've broadened the committee. I'm on with Chris Shays again, and I have the feeling that we're going to revisit Agent Orange. And I think we'll revisit it very strongly, and we're going to take a look at this Operation Ranch Hand. But what bothers me is the government is spending a fortune on it, and it does not, Don was telling me, who was over there, is you got people who were wading through swamps, they were eating food in the area, they were swimming in stuff that was heavily polluted by the stuff, and apparently they are not involved in that study, which seems to me to be a bit crazy. You would agree? So I gather you're...
if you're experienced with the military mind, it's not so far-fetched.
Okay. So we want to take a hard look at that. But where we may have made some progress, so there's a bit of struggle going on too, we know how long the Vietnam vets fought on this issue. What we managed to pass, what Shays and I worked on, we did a whole bunch of hearings. And at the end of the hearings, with my strong push, we issued a report, which I have right here, by the way, and would be happy to leave with you. This is, in my view, the definitive report, the best stuff that you will learn about Gulf War illness. Then what we did is we put the report language, our recommendations, into legislative form, and we managed to get it passed at the end of the session. Bottom line is now, although I got to tell you, there are some people who are fighting us even in terms of the implementation of the law, at least what we have passed for a start is a presumption that if you served in the Gulf and if you come down with one or another illnesses, and we think you were exposed to A, B, or C type of chemical, the presumption is that you got your illness while serving in the Gulf and you are entitled to benefits. So we have moved a little bit faster than the Agent Orange people.
Well, we're on this whole subject, and you touched on it a little bit. You know that a lot of the vets locally have been concerned about the VA hospital, the rumor that it's going to close.
Yep.
We've heard that doctors and other professionals are flocking away from the hospital and seeking other employment and things like this, which...
Very scary. Let me just say this, and just be as honest as I can. I have talked to the guy who makes these decisions and asked them point blank, and the answer is no. They're the best, there is no... the difficulty is you're dealing with, with the bureaucracy there, but I have not heard of any word that hospital is going to close down. Second of all, Senator Leahy, Senator Jeffords, and I, as soon as possible, will be meeting with those people who make those decisions and express to them in as strong terms as we possibly can that it would be a disaster for this region to close down that hospital. We'll do everything that we can to keep it open. Now, I know some rumors are circulating. The rumors are simply not accurate. I don't know about it, and nobody else knows that is a fact. Now, what I can say is what may happen in the future. But anyone who says they know for sure that the hospital is closing down that's not accurate.
I haven't heard that one. I've just heard the trepidation that...
Well, okay. Now what's going on?
It looks like...
What's going on is, that's right, in terms of funding cutbacks that have affected White River as well as a whole lot of hospitals around the country, there have been cutbacks, and those cutbacks are disastrous. And I guess, if you're a physician or you're a professional and you're not quite sure what's going on in the hospital, you may want to leave. And we're seeing that.
That's what we're seeing and
okay.
Making everybody
nervous.
We
are very cognizant of that issue. I think the hospital does an excellent job, and I know I'm speaking for Senator Leahy and Jeffords, will do everything that we can to see that hospital stay open.
We've also heard along that same subject the possibility that should something like that happen, that the VA, the Pentagon, is looking at the possibility that a vet could go to his own doctor and the VA would reimburse the doctor for the services.
There are a number of programs out there, some of them kind of experimental programs, and one of them has to do with what you're talking about is more or less of a voucher. For example, the hospital at White River is associated with the Dartmouth Medical Facility there, which is a very strong medical facility. And those are some of the ideas that are being talked about. As you also know, there is, up in Burlington, there is a branch, Apple Tree Bay, which is doing, the vets there feel very good about that. Good physicians up there. They don't have to go all the way down to White River, and that's working well. And I think there's an effort in Bennington as well.
Yeah, Bennington, that's a little narrower, the parameters of how they deal. But that's going pretty good. And we've been looking at something similar if and when we ever get Dodge House up to that point, or at least maybe a day or two a week.
I think that makes a lot
Tuesday,
of sense.
Thursday or something, because they won't have to drag their butts way the hell over there.
Especially in the wintertime, if you're not feeling well and your wife has to drive, you miss a day's pay, two people, So I strongly believe in a satellite.
They don't have a good history of informing you if your doctor's not going to be in and calls in sick today, so...
Is that right? So people
you
go
trot
there?
way the hell over there only to find out that Dr. Bujani is playing golf today or something and go home, and it doesn't sit too well.
No.
A couple things on your own initiatives that fellows asked me. I told them you were going to be here today, and a couple things they asked me is, what happened to the vet council that you had going a couple years ago? We liked that. And
it's still going. It's still going, and we will... The difficulty that we have is two things. We've held conferences, as you know.
Yeah, I think that's probably what they're referring to.
Yeah, we will do something like that again. And we thought that was useful. We brought Jesse Brown up a few years ago as the secretary of the VA. and other high-ranking people, and we think the vets appreciate that. We will do that again. We also have an ongoing Vets Council, which just met a couple of months ago, which I think is about 20 folks in it.
Okay. And along that line, they mentioned the bulletin. We had been getting what we assumed was some sort of a periodic bulletin, but we haven't seen one lately, and we wonder what happened to it.
It'll be coming out. We send out on a regular basis, not a regular basis.
There we go.
Irregular basis. A newsletter that goes to as many veterans as we can come up with. We don't have all the names, by the way, but many of the service organizations have been very helpful, and we've used those. We will continue that. And as I mentioned to you before we went on the air, probably the next newsletter will try to focus on veterans' benefits and be as clear as we can in explaining what benefits veterans are entitled to. Because we think, except for those veterans who are pretty active and up to date on this stuff, a lot of folks out there don't know that they may be entitled to A, B, and C benefits, which they should take advantage of. They just don't know about it, so we want to inform them.
I've always been surprised, in my job, that I always thought that maybe some of the younger fellows getting out and stuff weren't aware of that, but I'm amazed at some of the Second World War, Korean War type veterans who are coming into me now and asking how to be hooked up with a system that they've been out there for years and never asked for a damn thing, and now they need something and they don't know how to get in there.
And the truth of the matter is, and we'll try to improve this as well, the VA is a hell of a bureaucracy, let me be very frank with you, and they do not do, in my view, as good or an as aggressive job. I think part of their responsibility should be to make sure that vets know what they're entitled to. I don't know that they do that as well as they can. But let me do this. Let me, if I might, give an 800 number.
Sure.
This is my office. We try to help vets who are having problems. The number is 1-800-339-9834. 1-800-339-9834. It's in the book. And we want people, that is one of the functions that a member of Congress serves, and Senator Leahy and Senator Jeffords also have very good constituent caseworkers. Please give us a ring. That's what we're there for. That's what you've paid taxes for, not only to get information from your congressional office, but to get the type of help that you are entitled to from the government. So if there are VA benefits that you are entitled to, you have every right in the world to get them, and we will try to help you get them.
I had a good explanation from a World War II vet a while back. You probably maybe never heard it, but he said, when the VA was formed, everybody was joyous because it was going to be our voice to represent us in the government. And somehow or other, over these years, it's turned into a them and us relationship where we have to go to Bernie Sanders or Jim Jeffords or somebody to get our administration to serve us. And it's a shame that,
you're right,
even if it's not right, the perception is there that that's what
I think
it is.
it's a correct perception. I'm not going to sit here and tell you that I think the VA is a particularly responsive institution. I was glad a couple of years ago, I think one of the better appointments, I know people have mixed feelings about Bill Clinton, one of the better appointments he made is when he came in, he appointed Jesse Brown, who was had been a very aggressive head of the DAV. You remember that? And Jesse, and I knew Jesse well, and he tried very hard, but you're dealing with, what people should understand is, and I hope veterans pay attention to this issue, whether veterans programs are adequately funded or not are decided by Congress, and I think in recent years they have not done a good job, and no question in my mind that the VA bureaucracy has not been as responsive as it should be.
Okay. Another question that one of the fellows wanted me to ask you was, apparently several years ago in his first administration, Bill Clinton went to the wall, and one of the things he said there at that time was that he was going to see that some of these POW MIA records that for whatever reason have been sealed all these years and confidential, he was going to see that they were going to be open to the public. I don't know if you're familiar, but some relatives, the wife of a POW or MIA, sometimes can't even get access to his file and find out what supposedly happened to him.
To be honest
and
with
he was going to see that this was opened up to the world.
In recent years, a lot more records have been made open, but I can't speak intelligently on that issue. But again, if somebody has a problem, please give us a ring and we will do what we can. Certainly, everything being equal, people have a right to know with regard to POWs and MIAs.
And another question I think is a damn good question for some of the fellows is, the way we're going in Bosnia and over in Iraq and other places around the world, are we becoming a police force for the world? Are we sending American boys all over the damn world to police the world?
Good question. And that raises probably a discussion that will need 2 or 3 programs to deal with. So I'll give you very briefly my own feeling. People may disagree. You're caught in a dilemma, and this is the dilemma. If you see genocide taking place in Bosnia, what do? Do you turn your back and see genocide, women and children being slaughtered and tortured and not do anything. I think you don't. I think we learned from the Holocaust and elsewhere, civilized world cannot turn its back and allow these disgusting lunatics to think that they could wipe out thousands and thousands of people and no one's going to do anything. So I think as civilized human beings, we can't do it. That's number one. Number two, is it the United States' obligation alone to get involved all over the world? I think not. I think the United States, through NATO, through the United Nations, we should not be the only force. And it does concern me that too often we are. But I think the civilized world as a whole, through the UN, through NATO, cannot turn its back on genocide.
But what's the solution? Should we have, the UN should have its own little police force?
I think not its own, well, I think the United States should be working with the UN in a military way so that it is not just the United States participating, but the entire world going in there with troops of all countries, saying to these little fascists that no, they're not going to get away with impunity in wiping out women and children. The world should respond, not just the United States.
I'm just thinking back to the Bosnia. Remember last year, was it? There was a young man over there that they court-martialed because he didn't think he should be wearing the UN QP or whatever it was. He said he took an oath of allegiance to the United States, and I'm not putting on a foreign uniform. It says
it's not a question of putting on it. I don't know all the details, but I think the United States...
What I'm saying is I think perhaps it should be a separate, if you want to enlist in the UN peace force, fine and dandy, but just taking American soldiers and putting them under command of someone else to go do something else, I'd feel antsy about that.
Okay, that's a fair point. But on the other hand, I mean, to be honest with you, my point is, and some people will disagree with me, but I think you just cannot ignore genocide. I don't think that's good, because if you do it, then more these lunatics get the idea that they can do it as well, and it creates a very unstable and horrible world. On the other hand, do I think the United States alone has got to be involved in all of these things? Absolutely not.
Believe it or not, as usual, we've come to damn near the end of our time. We've got a couple minutes. Is there any last thing you wanted to say before we go off the air?
Just once again, I think there's a concern, and perhaps you'll agree with me on this, Jim, is that if the United States Congress or the VA are not responding adequately to the needs of veterans, then one of the solutions is the veterans themselves have got to be more involved. I mean, they're American citizens, they're taxpayers, they're veterans. So please get involved. Please write to us, my office, Senator Leahy and Jeffers, if there are concerns that you have. Second of all, if there are people who have particular concerns about Agent Orange that they would like to share with our office, or please give us a ring. Thirdly, there will be 2 important trials. These are breakthrough medical trials that will be conducted in the VA. They're going to begin, I believe, March 1st. If you know of anybody who is hurting with Gulf War illness, please call up the VA, call up our office, and it's going to be pretty much on a first-come, first-served basis. There are only going to be about 1,800 or so people all over the country involved in these trials, which will be analyzed at the end of a year or so. So if people want to get involved in the trials, they should move quickly. So that's pretty much what I wanted to talk about.
That about does it for our time. As always, it flies by. Thanks very much for being here. I
Jim,
appreciate it.
congratulations to your efforts.
Thanks.